Avoid unnecessary surgery. This Good Morning Washington Spotlight on Your Health is sponsored by Regenerative, Orthopedics, and Sports Medicine.
Well, it's Wellness Wednesday, and we're putting a spotlight on getting out of pain without surgery. I'm joined now by Dr. Sean Mulvaney with Regenerative, Orthopedics, and Sports Medicine. First of all, thanks for joining us here today.
Thanks for having me, Brian.
Excited to have you here. I want to talk to you and have you help us understand and explain ROSM's mission and how you offer patients a non-surgical alternative for addressing pain and injuries.
Well, really, when you get hurt, when you get injured, or as we get older and things start to wear out, what do you want? You want them to get fixed.
Right.
You don't want to just sweep dirt under the rug by taking non-steroidal anti-inflammatory drugs, which do not improve or heal pain. If you could avoid surgery, or if there are good alternatives to surgery, which honestly, sometimes there's not. But if there are good alternatives, then I would want to explore those before being committed to a long recovery period after a surgery.
Oh, that makes a lot of sense. Let's talk about some of the regenerative treatments that are available and that you offer.
We here at ROSM, we stick in the FDA guidelines. So we're using FDA-approved kits, we're using FDA-approved techniques. We're not using stem cells from a bottle or anything that is now very much frowned on. What we do is we use a person's own stem cells, which if you're alive, right, you're alive. So
I hope, right?
So every day we're healing. So every day we replace our gut lining every 3 days. We replace our skin every 7 days. So people are like, so age really isn't a factor. If you're alive, then you're regenerating. And we can actually harness some of those stem cells either from approved sources from bone marrow, approved sources from adipose or fat. And we can take those cells and we can actually use them to facilitate repair. Now, in some cases, we can get by with using some elements from your blood, like platelet-rich plasma.
PRP.
The core of all these is that when you get injured, when you work out, you get sore. When you get sore, you have inflammation. That inflammation is the vital first phase of healing. It's the only way anything heals. So sweeping that under the rug with drugs, non-steroidal drugs, or with corticosteroid, we've shown in multiple papers now that doesn't lead to healing.
Right.
So what we want to do is we want to restart that inflammation process. We want to restart the healing process. And a lot of times, through precise application, through very precision injections into the exact pathology, we can actually fix things. And isn't that what people want?
No, I mean, for sure. I mean, I think you just stated it here, but choosing regenerative options, I think, give you some real advantages over traditional surgical options.
And sometimes it's things like you're staring down the barrel of a neck surgery or a lumbar surgery. Ooh, sometimes those don't go how you want. Sometimes they're necessary, no question about it. But sometimes if they're not necessary, they're all alternatives. And a lot of times we can fix things with non-surgical means and get a good durable result that allows you to get back to doing the things you want to do.
Let's talk about the healing process and the timelines from surgical versus procedures that you offer. Are they similar, different?
The body likes to heal in motion. So a lot of times we can get by without having long periods of inactivity or long periods in casts or slings post-surgery. And we really want to get people moving on the sooner side. There's still a recovery process. Right. And when you get hurt, it's not like anyone's going to come and get a shot and go out and finish that vacation they just got bumped off of. It's still going to take usually on the order of months to heal something. But we can heal things. The recovery does go generally faster than surgery, but honestly, not always. Sometimes you're just getting away with not doing a surgery. Usually it's much faster though.
Let's talk about it now. For our viewers who are watching, they're intrigued, right? They're saying, hey, this might be something for me. What's that first step? What do they need to do to maybe learn a little bit more or see if it really would work for them?
Hey, if you're hurt and if you're not sleeping at night because of pain, if you're not getting through your activities of daily living, if you stopped exercising, that's no good. You're circling the drain. We've got to get you moving again. Get back to doing the things that you want to do, enjoying life. Get you out of pain, which you're not your best version of yourself. Call ROSM. Come in, have a consult. A lot of times it's covered by insurance. We'll tell you, it's in ROSM's interest to have you be well and have you heal. I don't know anybody who works here that's going to recommend that you don't have a surgery if a surgery is your best option. We'll tell you, you should have your hip replaced, no question. But if there's options, we'll present them. And we'll say, all right, look, you've been recommended for a spine surgery. Maybe there's something we can do short of that that'll still get you that same level of relief.
All right. It's very important information.
Without using corticosteroids, without using drugs.
Yeah, so very
sorry
important. No. I think it can help make a difference and help avoid some of those major surgeries. It all sounds good all around. Dr. Mulvaney, thank you so much for spending some time with us today.
Thanks, Brian.